This is the Museum of Forensic Medicine Department. This is the model showing rupture of liver. This is a model for cadaveric spasm, but actually that weed which was lying here is missing. So you have to just do some imagination. This is a model showing nose cut off. Usually the question asked in this case is what is the nature of injury. So in this case nature of injury is grievous as per clause 6 of section 320 IPC, which says permanent disfigurement of the face oblique head. Usually students forget to mention the word permanent in the exam. This is another photograph showing cadaveric spasm. You can see weeds in the hands. This is a short finding of ante-mortem drowning, or you can say pathognomic finding of ante-mortem drowning. Very frequently this photograph is kept for the Viva exam. This is a specimen showing depressed fracture of skull. This is a fracture of the vault of the skull, depressed fracture. It's also called a signature fracture because it gives the information about the weapon which has caused this fracture. Usually by the hammer, the striking surface of the hammer strike over the skull and produces this depressed fracture. When this is kept for the Viva, then examiners ask what are the other types of skull fracture. The fracture of then you have to tell fracture of the vault of the skull, fracture of the base of the skull, the fracture of the vault of the skull, or fissured fracture, depressed fracture, pond fracture, gutter fracture, and fracture of the base of the skull, or fracture of anterior cranial fossa, middle cranial fossa, posterior cranial fossa, and fracture around the foramen magnum. This is another photograph which is very frequently kept in the exam. This is showing froth coming out from the nostrils. It is a fine, lathery, copious froth, which is usually seen in cases of drowning. So you have to tell all the characteristic feature of the froth also. That the froth is fine, lathery, white, copious, consistent, and large in amount. This is another photograph showing laceration of liver, and usually the question asked in this case is what is the cause of death. This picture is usually seen in the roadside accidental cases, and the cause of death in this case is usually hemorrhage and shock. See, in forensic medicine always the examiner after autopsy is concerned with the cause of death. So very frequently question asked to the students what is the cause of death. So in this case cause of death is hemorrhage and shock. Again this is a model showing fine froth coming out from the nostril. Again a case of drowning, case of typical drowning. You should know what is typical drowning and what is atypical drowning. In typical drowning we see all the typical features of drowning, that is a froth from the mouth and the nostrils. Then we can see the weeds in the hands. Okay. The internal findings we see in the lungs, in the stomach. Okay. In drowning cases, you should also remember the two tests. One is diatom test, other is Jettler test. Now this next model, you can see the bleeding from the nostrils, around the mouth, plus on the neck you see this crescentic abrasion marks. On one side of the neck there is one mark representing thumb, and on other there are 4, 1, 2, 3, 4 of the 4 fingers. Plus you can see some abrasions over the neck also. It's a case of manual strangulation, that is throttling. Manual strangulation, throttling, which is a violent asphyxial death. It's a violent asphyxial death. This is a case of, it's showing injury over the flank of the abdomen. Here it's written stab injury by the single-edged weapon on left side of the chest. Okay, sorry, it's chest, not abdomen, it's on the chest. Stab injury, but sometimes it becomes very difficult to tell whether it's a stab injury or it's an incised wound just from the model, because we can't assess the depth. In stab, the main thing is the depth of the wound, because in stab the depth is the greatest dimension. In incised wound, the length is the greatest dimension. Incised wound, there is one more feature, that is the tailing of wound. So in this case, even this tailing is also there. You can see on this side, and we can't assess the depth. So you can get confused whether it is an incised wound or stab wound, because on upper side it is written stab, but from the picture it can even be an incised wound. So even if the student answers the incised wound, it will be right. Then other models that we have in the museum, these are various fingerprints. Again, very commonly asked question, what are the different fingerprints? So one is arch, other pattern is loop, other is whorl, and the fourth is composite. So there are 4 patterns of fingerprint, and the most common pattern is the loop pattern. Most common pattern is the loop pattern. This time this question was very commonly asked from the student, which is a surest sign of identification. Which is the surest sign of identification of a person? And the answer is fingerprint. This is this fingerprint, that is dactylography. It's not DNA fingerprint, because DNA fingerprints can be same in cases of identical twins, but the fingerprints of the identical twins will be different. So in that way, fingerprinting is even better than DNA fingerprinting. There is one Quetelet rule. Quetelet rule, again very commonly asked from the student in the Viva. Quetelet rule, that is, no 2 persons have same fingerprints. No 2 persons have the same fingerprint. That is Quetelet rule.